today?
Oh, I'm in a little bit of pain.
My name is Tatiana Fuster. I am a pharmacist. Please sit down.
Thanks.
What's happened, Samantha? Could you please tell me
I was
everything?
hiking a couple of days ago and I sprained my ankle.
How many days ago?
2 days ago?
Samantha, did you receive any medical attention?
I did. I went to the local clinic at the base of the mountain and they took an x-ray there and they didn't see any broken bones. They just said it was sprained and that was all.
Did they prescribe any medication for you?
They just told me to take Tylenol. I think that's, yeah.
How many times a day did you take it?
I was taking it 4 times a day.
Did it give you any relief of pain? Did it help?
No, very minimal, because I'm still in a lot of pain, if any at all.
What makes it worse?
Definitely if I stand on it for a length of time. I work on my feet, so over the course of a day, it seems to get worse. And they told me to ice it for a little bit when I was at the clinic, and I was doing that, and it helped a little bit. But then when I stopped icing it, it just came right back.
Anything make it worse?
Just standing on it for a long period of time and walking on it.
During the day, could you tell if in any part of the day it's getting better, getting worse?
It's worse in the evening for sure. After having been on my feet all day, and it seems to be a little better in the morning, but still painful. I've been taking the Tylenol right before I go to bed to hopefully relieve a little bit of the pain so I could sleep. So it's because that's when it's at the worst pain.
Samantha, does it pain stay in the same spot or it's irradiate or spread anywhere else?
It's mainly in my foot and then up to my knee. I think that's my knee. That's where it hurts.
How would you describe your pain? Is it sharp pain, dull pain, throbbing pain, continuous pain?
It feels like a sharp, continuous pain. Like it's always there, it seems.
On a verbal scale from mild to moderate to severe, how would you describe your pain?
Probably moderate. Yeah.
And on a scale from 0 to 10, where 0 it's no pain at all, and 10 it's the worst possible pain you ever experienced, how would you scale it?
I would say probably a 5 to a 6. A 6 is probably at in the evening when it's worse.
What kind of pain relief are you expecting from your medication?
Immediate pain relief, hopefully, as soon as possible. Would be great.
Yeah, that would be wonderful, isn't it? Tell me, did you experience any pain in the past, and did you receive any medication for it?
I remember taking a similar incident a couple years ago. I remember ibuprofen. Does that sound right?
Yes.
But it wasn't. I mean, it was a similar accident, but it wasn't as severe as this time around.
Do you remember for how many days did you take ibuprofen?
I think I'm going to take it a couple of days, and the pain seemed to have gone away after that. Not very long. I was very happy with it.
Do you remember if you had any side effects on that medication? Itchiness, nausea, vomiting, rash, skin rash?
No, not that I can remember. No, it was fine.
So a couple of years ago when you received ibuprofen for your pain, it's worked very well and you did not have any side effects.
That's correct.
Tell me please, do you have any allergies for any food or medications?
I do not.
What kind of medication do you take daily?
I take a multivitamin and Trisprintec.
Alright, how you consider yourself? Do you consider yourself a healthy person? Do you have any kind of ongoing health issues right now?
No. I'm an avid hiker. I exercise daily. I eat a balanced meal. I feel like I'm in tip-top shape.
Wonderful. Okay, Samantha, I think what I would like to do, I would like to give you ibuprofen this time, and I would like to verify it with your doctor. But before I do that, I will be glad to take a look on your leg.
Okay.
Do you mind?
No, sure.
So please take your shoes off and pull your pants a little bit.
And my socks too?
Yes, please. Sit right enough. My idea is I could see it swollen a little bit. Does it hurt when I'm touching it?
Just a little bit.
Alright, could you move your toes for me, please? That's enough. When I'm touching it, do you feel it?
Yep.
Everywhere?
Yep.
Can you feel it?
Sure.
Well, besides the fact that it's swollen a little bit and painful, otherwise your leg is looking just fine.
Okay.
Okay? So please put your socks and shoes back on. I will call to your doctor and I will come back to you in a couple of minutes.
Okay. Thank you.
Hello?
Hello, my name is Tatiana Houston. I'm a pharmacist from MCPHS Pharmacy. May I please speak to Dr. Gandhi?
Yes, speaking. How can I help you?
Hello, Dr. Gandhi. I'm calling about your patient, Samantha Ganian.
Mm-hmm.
She was in a little hiking accident a couple of days ago, and there's been acetaminophen for her pain. And unfortunately, it did not provide her with substantial pain relief. What do you think if we will give you ibuprofen 400 milligrams every 4 to 6 hours instead as needed?
Can you please verify Samantha's birthday for me?
January 1st,
Mm-hmm.
1991.
Okay, thank you. I think ibuprofen 400 that you recommended is just fine. You can go ahead and give it to her.
Right, let me please repeat it to you. So
Okay.
I'm going to give you ibuprofen 400 milligrams by mouth every 4 to 6 hours as needed. One more thing, doctor. Would you like to see Samantha?
For a follow-up, I can see her next week on Monday, but if anything gets any more serious, then she can come see me immediately.
Okay, thank you. Could you please tell me what is your MPI number?
007.
Thank you, doctor. Have a nice day.
All right, bye-bye.
Alright, Samantha, I just talked to your doctor and she agreed to prescribe you ibuprofen 400 milligrams by mouth every 4 to 6 hours as needed for your pain.
Okay.
Let me tell you a little bit more about your medication. Ibuprofen is anti-inflammatory medication which could cause some side effects, as mild as headache and dizziness, nausea, vomiting, and as severe as abdominal bleeding. So please be aware of it, and if you will see black stool or you will see red blood in your vomiting, please contact your doctor immediately.
Okay.
You have to take that medication with plenty of water to avoid those abdominal side effects.
Okay.
Okay? You will receive pain relief basically almost immediately, like in the first 30 to 60 minutes. And it will last for at least 4 to 6 hours.
Okay.
Your doctor would like to see you for your follow-up in 1 week on Monday.
Okay.
If your pain will be substantially released. If not, if your pain will be still moderate to severe, please contact your doctor as soon as possible.
Okay.
Do you have any questions for me, Samantha?
I'm just able to still go to work, right?
Yes.
Okay.
Yes, absolutely.
Yeah. I think that's all that I have.
Do you mind to repeat that information for me? How you're gonna take medication?
Sure. So I'm taking ibuprofen. It's 400 milligrams every 4 to 6 hours, as I need it for the pain, and it's gonna cause like headache or
It's my
dizziness.
cause headache.
It might
Why
cause
not?
headache, dizziness, nausea, some diarrhea. In the worst case, some abdominal bleeding. And so if that were to happen, contact my doctor immediately. Or if I'm vomiting or if I see it in my stool, the blood in my stool, then to contact Dr. Gandhi.
Yes.
Is that right?
Yes, absolutely. Absolutely. All right, Samantha, if I could help you with anything else today.
I think I'm all set, doctor.
Thank you, Samantha, for the opportunity to help you today. And please give me a call. Let me know how you're doing in a couple of
I
days.
will, sure. Thank you.
Thank you. Have a nice day.
Thanks, you too.